This video talks to women who may have PCOS and don't even know it. That might be you, and I will explain in a minute. We will look at some facts about PCOS and symptoms that might indicate that you have this condition. And make sure you stay till the end of this video so that you can learn what you can do next if you suspect you might have PCOS. Hi, I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. On this channel, we discuss health information to help you feel and be better. So if that sounds right up your street, make sure you like this video and consider subscribing to my channel. And don't forget to follow me on social media, Instagram, Facebook, Twitter as @AskAwayHealth. PCOS, or polycystic ovarian syndrome or polycystic ovary syndrome, is a hormone balance problem where several immature follicles exist in the ovaries. The ovaries are part of a woman's reproductive organs, and if they are not okay structurally or they're not working well, that can lead to many problems. Let's look at a few common questions around PCOS. First, how common is polycystic ovary syndrome? PCOS is so common it could affect 1 in every 100 women. So it is possible that you have PCOS and don't even know it. In addition, more than half of the women with PCOS don't even have symptoms, and that's why I'm saying that it could be you. Next, how long does polycystic ovary syndrome last? It's a lifelong or chronic condition. There is no cure, but if there are symptoms, they can be controlled depending on how severe they are. Does polycystic ovary syndrome hurt? Yes, it can be associated in some women with pelvic pain, and they could also have irregular or no periods at all. What causes polycystic ovary syndrome? The exact cause of PCOS, we don't know, but it does run in some families. I mentioned it's a hormone balance problem. So which hormones are out of balance in PCOS? There are a number of different hormones out of balance with PCOS. The ones that we commonly identify include testosterone, the male sexual hormone, which women also have, but normally in very low quantities. In PCOS, the levels of testosterone are excessively high. The other hormone that's out of balance in PCOS is insulin. Insulin controls blood sugar levels in the body, and in PCOS it's excessively high. So what are the problems that happen if a woman has PCOS? First, your ovaries might be larger than normal, and this is because they have several of these fluid-filled follicles that are immature and so prevent the release of an egg as should happen month after month in a woman. And of course, the fact that the ovaries are not releasing egg during each menstrual cycle means that PCOS can be associated with fertility problems. So what symptoms could indicate PCOS? Hair loss or thinning hair. On the other hand, some women could have excess hair or hirsutism because of the abnormal high testosterone levels. There could also be acne or oily skin. Some women experience pelvic pain, irregular periods or absent periods. Many women with PCOS are also overweight, and the fat usually accumulates around the face, the chest, the back and the buttocks. Another common symptom that happens with PCOS is being extremely fatigued, and that is when you feel so tired even though you haven't carried out any activity that could explain the degree of tiredness. Now let's look at the hormones again, testosterone and insulin. Many women who have PCOS are resistant to the action of insulin in their bodies. And so for the body to compensate, it makes more insulin. But there are many problems with this. One of them is that more insulin leads to the woman's body making even more testosterone than she needs. And because she's overweight, her body also produces more insulin. Women with PCOS have an increased risk of developing diabetes, and it is related to the problem with hormone balance. So there is no cure for PCOS, but there are different degrees of PCOS. We've said that 50% of women who have this condition don't show any symptoms. In other words, they have essentially normal lives. Some women have mild disease without any visible symptoms. Others may have moderate or severe forms of the disease. So you could have PCOS without any period problems, no challenges getting pregnant. Your hair may be a little thin, or you might suffer with a little bit of acne. But other ladies might have irregular periods and difficulty conceiving, which then brings them to their doctor's attention. What about the treatments for PCOS? Now, this will depend pretty much on the specific issue that PCOS is causing for a woman. It may be the pelvic pain that the woman is experiencing, or the fact that she can't fall pregnant. But first, if you're overweight, losing weight and following a balanced diet with regular physical activity can improve some of your symptoms. 2. Some medications can help with treating symptoms like excessive hair, irregular periods, or infertility. And number 3, surgery is an option if some of these fertility medications do not work. A simple surgical procedure called laparoscopic ovarian drilling might be recommended, and here the doctor will use heat or laser treatment that destroys the tissue in the ovaries that is making the excess testosterone. And with treatment, many women with PCOS can get pregnant. So if this video makes you wonder about whether you have PCOS and didn't know it, make sure you go and use my email health information service or the digital concierge service. I will place the links to both of these in the description box below, and let me know if we need to have a chat to discuss your symptoms and guide you to the next steps. Thank you so much for watching. Remember to like the video and subscribe to the channel. Check out these other videos here, and I'll see you again soon.